All right. So as I was saying, you're going to be more likely to develop arthritis, bursitis, various inflammatory conditions in the joints if you don't have good control, or you're just kind of locked up and stuck in part of the area of the joint and can't move freely through the whole aspect of it. So posture, breath, body awareness, all key components to what we're working on with the joint health. Today's program is about lower body. We'll do a warm-up for your ankles, for your knees, for your hips, and kind of pelvis and low back. And then we'll move into the more intensive therapeutic aspect of the session today with a focus on that mobility and control of your hip joints. So with that, let us begin. So go ahead and let's start. Sorry, let's start before anything else. I so often forget to do the assessment at the very beginning. I like to do an assessment. I'm going to hit mute all here for everybody. Unmute yourself if you'd like to. If you'd like to speak up at any point to ask a question, please do. If you have a question, good chance that somebody else in the group has had the same question and hasn't asked it yet. So we're going to start with our assessment before we even do our posture cues. So just go ahead and stand in a comfortable manner for yourself. Maybe just walk in place for a moment, and just your squat distance here will just be the distance that your feet land, or a little wider if you want to make it wider. But if it feels okay where they land, then go ahead and bring your arms out in front of you. And 4 to 5 times, I want you to squat down towards the floor. So think about keeping your back straight, and think about sitting down in a chair. Maybe the first few times you don't go as deep as you possibly could because you're warming up a little bit. But by the 4th or 5th one, I want you to challenge your range of motion with this caveat. I want you to keep your back as straight as you can. So if you start to feel your back noticeably rounding, then that's your squat depth for right now for the purpose of this assessment. So how deep can you go with your back straight? A not straight back would look something like this. All right, a straight back would look more like this. If you're not sure, you can put your hand on the lower back and get a feeling from that when that spinal alignment is changing, when things are starting to round out. So the depth of your squat, and just as one measurement for you to pay attention to, the other is just the overall sense of ease, fluidity, etc., or lack thereof, as well as any disparities. Maybe it feels very different in your right side versus your left side going into or coming out of that position. So now that we've done that, we'll review that or come back to that a couple times during the session for comparison. So now let's get into our posture primer here. So standing with your feet fairly equally, with equal weight between both feet. So maybe you rock side to side for a moment, kind of figure out where your center feels like your center is. Feet basically straight ahead, can be turned out a little bit and close to about hip width apart. There's no perfect position, but just a comfortable standing position for you as far as your feet distance. Bring your pelvis such that it's going to sit more over your ankles than the front of your feet. To be more specific, you find this most outer bony part of the pelvic hip region here, and try to bring that into a straight line over your ankle. For many of you, that might make you feel like you're pitching forward because you're used to having your pelvis forward and leaning a bit back with your upper body. So to get that upper body more aligned, once you've got your pelvis set back a little bit, you want to reach tall through the back of your head, reaching, like, all right, up, and with the chin staying down, we're not lifting the chin up there, we're reaching more so the back of the head up, and we're anchoring the rib cage in with this. So an unanchored rib cage would be the tendency to flare the rib cage forward and overextend and tighten the back. So we want to keep this more aligned in a vertical manner over your pelvis, not like this, but like this, and reaching tall, head kind of trying to stay up and over your rib cage and not out in front of it. All right, so from that position, what we're going to do is begin to work on the breath. So bring one hand to your lower belly, maybe just between the navel and pubic bone, or even right on top of the pubic bone. One hand just behind that on the opposite side of the body, and begin to breathe in such a manner that you would intend to bring space between your hands, like you're filling up a balloon, blowing air into a balloon as you inhale, filling up your pelvis with air. And continue to do that. So breathe slowly, inhaling and exhale. Take anywhere from 4 to 5 seconds or so with each exhale and with each inhale. Check in with your posture. You may be drifting back and kind of to your default. So if so, reset your pelvis, reset your length upward, anchor the rib cage in. And just continue to breathe in this manner while I give you a little bit of understanding the value and importance of this. A few key things that this breath is doing for you right now. One, is just helping you get more present and conscious in your body. As an extension of that, it's helping to activate neurologically this area to prep it for more movement. It's helping to set your nervous system more in the parasympathetic zone, which is your rest and digest part of the nervous system, that also allows you to take in new information and do something with it, break old patterns and habits that might create excessive tension in the body. And then it's also a mechanical, there's also a mechanical benefit, particularly as we get into some of these deeper stretches. You're bringing breath into this pelvic region. We're stretching from the inside some of the same muscles that we're stretching, we could say, from the outside for the sake of comparison, by getting into a position. So we get into a position, we've got that external stretch, and then we breathe into it, and we're kind of pushing into that muscle from the other side. So mechanical benefits too. So go ahead and relax now as far as that intentional breathing, and we'll transition into our movement warm-up. So as I said earlier, we're going to start with ankles. So we're going to start doing the ankle warm-up without weight on the ankle. That's the mobilized one. Then we'll shift to doing some mobility work with weight on the ankle. Just a moment. We've got a little one coming in here. Hey, Lydia. You want to say hi to everybody? You say hi, and you'll have to go back if I'm on it. Yes. Miss Lydia Violet. You want to wave? Say hello. Do you speak? Do you speak? Do you have words? Hi. Yeah, okay. I love you. All right. Go up. Sit with mom. Now you've got to go be with mom, okay? Love you. Thank you. All right. So standing nice and tall on one leg. Put one hand on a stable surface to help you balance here. Take a straight knee, lift the leg off the floor, point and flex the foot up and down. Go slow, find your full range of motion right now. We're going to aim to do 5 to 10 warm-up movements with each joint that we focus on today. Now turn your ankle in and turn your ankle out. So that's like turning my heel in and out. My whole leg's going to rotate a bit as I do that. Keep the knee straight. All right, now let's do circles. So think about drawing a big circle with your toes. Start in either direction. Check in with your posture here. Keep that pelvis set the way we had it when you're standing on 2 legs. Keep that length of the upper body. Circle the other way. Go slow. Find that full range of motion that you have available to you right now. Great, and relax. All right, let's switch it up. So just shift your weight slightly now to the other leg. Set yourself nice and firm on that leg. Lift the leg you've been standing on. Flex the ankle up and down, pointing the toes towards the floor and up towards the ceiling. Go slow, discovering your full range of motion. All right, turn the ankle in, turn the ankle out, in and out. Keep the knees straight. Stay nice and tall. And now we're going to transition to circling. Draw as big a circle as you can. Go slow. Go slow. You're going to get so much more out of these exercises if you go at a pace that allows you to explore your full range of motion. Change it up. Now, some of the warm-ups, we're not going for full range of motion, but right now with the ankle, we are. When we get into the deeper stretches, we're we are going for full range of motion, the full range of motion particularly that you'll be able to control yourself getting into and out of it by using the muscles that aren't the same ones being stretched, and relax. All right, so now we're going to transition to warming up the ankles with some weight on them. So take a nice wide stance, toes, feet pointed straight forward or almost straight forward. Shift your weight to one side, and side you move away from, drop that ankle down towards the floor, and then come back to center. So you're shifting away, rolling the ankle in, opening up the inside of the ankle joint with a little bit of weight on that foot, but most of your weight is shifted into your other leg. If you feel any discomfort at the knee, two things to do: stiffen it, stiffen your knee more. If you still feel discomfort, don't go so far with the movement. All right, let's switch to the other side. So when you go to the side, as you're bending the knee, have your butt drifting back at the same time. That'll put less stress in the knee. That's your support leg. If you get that butt going back more as you shift your weight into it, you don't have to get it going back too much, but if you're not going back a little bit with your hips, you're going to be putting unnecessary weight in the knee. All right, so now stand up, stand on one leg, step forward with the other. Keep about 70% of your weight on the back leg, not leaning back like this, staying nice and tall over that leg the same way you would if you were parallel or balanced with your feet. So you step forward, flex the front foot up and down. So down to the floor, up to the ceiling, down, up, Actually, sorry, that's not what we need to be doing right now. What we need to be doing is this. You've got Lydia sitting over here watching. I got a little distracted. We're rolling the ankle out to the side like this. So my knee is straight, about 70% of weight on my back foot, rolling the foot out, opening up that outside of the ankle with a little bit of weight on the leg, but not a whole lot. One or two more, and switch your stance. Step forward with the other foot. Set your weight strong and tall on the back leg, about 70%. Roll the ankle out, opening up the outside of the ankle. Five to 10 times. And relax. All right, so let's move now to, let's do this. Let's do ankle circles this way. You're going to stand nice and tall, one hand on a surface to support you. You're going to circle your foot around. Think about drawing, so your toes are on the floor, and you're doing that same type of circling movement you did before, but now the circle is being drawn by your heel, and you're kind of just pivoting around the toes, and we're going to circle in both directions. So I'm not demonstrating holding on to something, but I advise that you do. The less your body has to worry about controlling your posture, the more it can focus on doing the mobilization work. All right, so switch it up if you didn't switch it up. Do a few and then switch to the other leg. So I've got about 90%, I'd say, weight on one leg and about 10% on the toes of the other leg as I circle around, opening up the ankle. A little bit of weight on it. And circle the other way. And relax. Good. Okay, now we're going to move up to knees. So stand tall, but soften your knees. Okay, and we're going to circle the knees around to the front, side, and back. So actually, let's start with knees straight and then relax them. Shift your weight to one side, come to the front with the knees, to the other side, and then all the way back to straight. So just think about taking both knees or kneecaps and drawing a circle over your feet. Start in either direction because we'll go the other way in just a moment. Now this is also a nice movement for your ankles too. We've got a lot of circling happening at the ankle joints. And switch it up and go the other way. Keep going with that, and I'll be back in just a moment. Come on, sweetie. Come on. You can't be doing this, okay? You have to leave. Okay. You're distracting me. People are hearing you. No, I'm not doing it. All right. I'm back. I was going to let her stay, but she was getting more and more noisy, and I knew where that was headed. It was going to get louder and louder and more distracting for all of us. So, all right. We did knee circles that way. Now we're going to do knee circles one at a time. So go back to that stance where you're going to have about 70% of your weight set back. And come onto the front foot and draw a circle with that knee over the front foot. Again, start either way because we're going to reverse it in just a moment. Your weight, as you do this, your weight will kind of be rocking back and forth across the base of your foot, but try to keep the whole foot in contact with the floor. Circle the other way now. So don't go so far with your circle that you completely lose contact with either inside or outside of your foot, but your weight will be shifting. And try to come all the way back to that straight knee position at the end. All right, and switch it up, other foot. Circling from straight knee around, back to straight knee. Getting that nice rocking motion through the foot while keeping some contact with the whole foot throughout. Check out your upper body posture here. Stay nice and tall, keep those ribs anchored in. And reverse your circle if you haven't. All right, good. Ankles, knees. Now we're going to move to our warm up for the hips. And think of this as kind of a cleaning out of that joint, all right? So again, we've got the pelvis, the socket that the femur, the head of the femur comes up into, and we're going to have a stable socket, and we're going to be circling around and cleaning out debris and loosening that joint, getting more fluid into different spaces of the joint that might typically be a little bit dry and dehydrated. So you're going to stand nice and tall on one leg, take the other leg out in front of you with the straight knee, and just start drawing a circle. Now this, we're not looking for full range of motion. We're not doing a big circle right now. Anywhere from small to maybe medium-sized circle. Go the other way. I'd say what I'm drawing right now is about a medium-sized circle. And relax. Take that same leg out to the side now. Start circling. Try to stay nice and tall. You're using your support surface. Notice if you're leaning out over upper body outside of your standing leg, try to be over top of it. Circle the other way. But also try not to have that hip and pelvis swaying or poking way out to the side either. From your ankle to your hip through the side of your body, you want to think about having as straight of a line as possible. All right, going both ways there with that. And now we're going to take the leg behind us from a nice standing tall position. Don't go so far back with the leg that you pitch yourself forward. Keep yourself as vertical as you can as you do the circle behind you. And after 5 or 6, switch it up. And relax. If you're like me, you're already feeling a little bit of burning and a lot of work happening in the standing leg. Quite a few things we've done already with just standing on one leg that are going to be strengthening these hip muscles, but make them talk to you as well. Take that same leg across the body now and do some cross body circles. Small to medium size. Keep the knees straight. Switch the direction. Go the other way now. And relax. Good. All right. If you need to, take a moment, shake it out, smooth those hips around, pound on them if that feels good. It feels good to me. All right. Now we'll go to the other side. So stand nice and tall, straight leg, small and medium-sized circle in front of you, 5 to 10 times, and reverse. Now at some point, I want you to start bringing your attention now to breathing down into the belly like we practiced earlier. So bringing that space into the pelvis. Take the leg out to the side now. Begin to do your circle and come back to your breath. Like you're inflating a balloon. Your pelvis is the balloon. You're bringing space to the bottom, to both sides, side to side, front to back. Reverse, if you haven't yet. Try to keep that straight line from your ankle to your hip, to the side of the rib cage, over your standing leg, and relax. Take this leg behind you now. Stay nice and tall, so you don't go too far back with the leg, and pitch yourself forward and circle. Small to medium-sized circles. And reverse. Keep coming back to that breath if you can. It might be a little bit like rubbing your belly and patting your head, which interestingly, Lydia, who's 6, came down yesterday while I was working and stood beside me and did that for about 5 minutes. And I've never seen her do that before. I have no idea when she learned to rub her belly and pat her head, but she was doing a great job with it. Take your leg across the body, circle, and reverse. So what we've done so far, what we'll finish up with here in just a moment, relax, these warm-up movements. Let me just take a moment to explain to you how you might use these in your life, depending on where you're at on that spectrum of kind of pain / mobility issues to, you know, full body fitness. What we've done so far, any of these things are a great little warm-up that you could do as part of any other stretching flexibility routine. Quite a few people have told me just doing this type of work alone has really started to loosen things and free up some pains and stiffnesses that they've had for years. That's without getting into the more intensive part. If you're going to do it for therapeutic purposes, you need to be doing some version of this daily and probably spending more repetitions instead of 5 to 10 reps. You probably want to do more like 10 to 20 and maybe do 1 to 2 sets of that. Maybe do that a couple times a day if you're really trying to therapeutically intervene with what's going on. But if you just want to apply this in a very simple manner, just toss it in at the beginning of some you know, just a few circles with any of these different areas of the body. It doesn't have to be all of them. If you've got really stiff ankles or really stiff knees, do the ankle work and knee work. It'll take you a few minutes, and over time it could help you out quite a bit. All right, back to our work here, finishing up the warm-up from your nice tall position. We're going to tilt your pelvis down towards the floor and then the opposite direction, tilting it down in the back. So you can think about your tailbone lifting up, putting some gentle arch into the lower back, tailbone tucking under, flattening the back. Keep that link through the upper body. Keep your head set over your rib cage. Keep the back of your neck long by keeping your chin down just a little bit. All right, and now we're going to do pelvic tilt. So for this, I'm going to bend my knees slightly, and I'm going to hike one side of my pelvis up towards the ribs on that side as the other side drops down. So my pelvis is now leveled like this. This knee on the drop side is more bent. This knee on the lifted side is straighter, and then I'll go the other way. So this has a lot to do with your knees, but there's lower back muscles too, and abdominal muscles that can be assisting with hiking the pelvis up. So it's legs and hips and lower back that are all involved with generating or creating this movement. Think of the position you might get into if you wanted to be super sassy on the runway. All right, and relax. Now we're going to take your pelvis and move it in such a way that your upper body is going to go along with it. In this case, we kind of had some lower back movement happening while the rest of the body above and below the pelvis stayed stable. Now we're going to move the whole pelvis in different directions with the body, upper body going with it. So from a tall position, we'll tip forward, and then we'll go the other way. So think of this as a hinging movement. We hinge forward with the upper body. We hinge back with the upper body. Your spine, your rib cage, your head, shoulders, everything moves with one unit, moves as one unit with your pelvis. So when your pelvis is moving one way, it's tipping what's above it in the opposite direction. All right, you need to have your abs nice and engaged when you go back so that you don't crunch up your lower back. All right, and relax. Now we're going to do that same type of thing, just side to side. Okay, try to keep that spine straight here. Lowest part of your spine is going to be doing a little bit of bending with this, but don't collapse over. We're not doing this. We're not side bending through the spine. We are going side to side with the pelvis, and the spine happens to tip the other way. And now we're going to take our pelvis and stir it over our feet with the spine, again, moving with it as one unit. So pelvis goes back, I tip forward, drawing a big circle over my feet with my pelvis. So it basically combines that front to back and side to side movement and connects them with the circling. And reverse, go the other way. This is our last one before we get into our more therapeutic work for today. So I haven't said this in the last few sessions, so as a reminder, why do we do these different directions with the joints? So each joint, you can go ahead and wrap that up. Each joint in your body is designed to do a little bit of the following. Most joints have one or two planes of motion that are primary, and maybe the third one that is they can do just a tiny bit of it. Some joints, like the hips and shoulders, are designed to ball and socket to pretty much go in all directions. But those planes of motion, if we just compartmentalize them and simplify it, it's front to back. I'm demonstrating that with my shoulders or my hips now. That's front to back, side to side, right? And then rotation. So this is rotation of my femur. This is rotation of my pelvis. So we took all those joints that we just worked on through all three of those planes of motion before we moved on to the next. All right, so now let's do some deeper work that's going to stretch muscles, strengthen muscles, keep cleaning out the joint, but add some control and stability to your joint. What we don't want is a lot of flexibility with not the ability to control that. And there are some people that are very flexible, but they're more prone to injury because they can't control that flexibility. They can go into these big ranges of motion, but their body doesn't do an adequate job, particularly in range, of stabilizing, slowing things down, getting them out of it. So that being said, let's begin with sitting in a chair. So I'll give you a moment to come to a chair. I'm going to get my camera pointed down just a little bit here. All right. All right. So let's just do a little bit of sitting posture primer. This is going to relate to one of the exercises we're going to be doing in a moment. So when you're sitting in a chair and you're not using the support of the back, if you are using the back support of the chair, I always say, get your behind you, get your butt all the way back as far as it can go, and then you can lean back into the support so that you don't have the pelvis away and round out the lower back and stress those lower disc, ligaments, and SI joint down there. So, but if you're not using the support of a chair, you want to have the good setup on the base of your pelvis. So for this, we're going to hinge back and forth with a straight back. So you feel yourself rocking across those bones at the base of the pelvis. So when I go back far enough, I'm kind of putting my weight into the bigger butt muscles there. As I come forward, I feel the contact with the bones at the base of the pelvis. And as I come forward, I lose that contact, and I'm more sitting towards the upper hamstrings, back of the thighs. So just find that range. There's, a little bit of range where you're noticeably in contact, and then a very small area where you're kind of seated right on top. I like to go from the forward position, rock back slowly until I just if I go slow, my body will just naturally come to a place of like pause, and that's where I like to be as a general rule of thumb, to have good foundational support with my pelvis for what's above it when, say, sitting at the computer. That being said, I'm just like everybody else. I doubt there's many humans that can sit with great posture for long periods of time at a computer before they start rounding forward. So that's why it's important to not sit for too long without taking breaks. All right, so now that we've done that, we're going to work on activating the psoas muscle. Now, the psoas muscle has multiple functions. It is one of the most, if there's the most important body in the muscle in the body, it's psoas has got to be right up there at the top of that list. It attaches from the front of your spine to the top of the femur, so it crosses across your hip joint. The lower 5 vertebrae, L4, L1, 2, 3, 4, 5. From there, it's originating, coming down to here. So it's a very long muscle, very steep in its orientation. So if you know a little bit about anatomy, you may know the hip, the psoas is a hip flexor. This is hip flexion. So is this. It's shortening the distance between the angle of your hip joint in this direction. But most people don't know that before the psoas assists with this movement, its job is to actually help pull the femur up securely into the socket so that you've got good stability there, so that when you go into flexion or rotation or extension, you're not banging around and unnecessarily creating wear and tear throughout the cartilage of the joint. So that's going to, as we go through this exercise, at times I'm going to say, think about sucking or pulling your femur up into, your femur is this long thigh bone, up into your pelvis. So as again, long muscle, so we're going to work on activating both ends of it, the lower end and the upper end. So to accomplish that, what we're going to do is come to your, towards the front of your chair, and from a knee straight position, let one leg just kind of roll out to the side like this. So I just let this leg kind of flop out. And then I'm going to, from there, I'm going to round my back. I'm going to slump. So I'm going to let my pelvis roll back and come back behind my base of support. All right. Next, from that position, what I'm going to do first is take my hand to the same side of the leg that's rolled out. I'm going to brace across the top of the knee, maybe a little bit more pressure to the inside of the knee. Then I'm going to press the knee up into the hand as if I'm doing this movement, but I keep the pressure down enough that I can't get the leg off the floor. So that's starting to activate the lower end of the psoas. And now I'm going to come up onto my base of support and slightly in front of it as we practiced a moment ago. So I'm going to, from the side view, I'm going to keep that pressure. The knee's going to keep pressing into the hand the whole time as I draw myself up and over with the upper body, pelvis tipping forward and going to slightly lean forward. And then I reverse it. I come back. Towards the end of that, I let my back round. And then to complete it, I'm going to relax the pressure of the knee into the hand. So we'll repeat that several times. I know that's a lot of information. It's very, the details matter here. The details matter. The details are oftentimes the biggest difference between doing the therapy program or therapeutic exercises that help you and therapeutic exercises that don't help you. It's not really about the exercise, guys. In most cases, not nearly so much as about how you do it. Your body can tap. Every joint has multiple muscles that can help move it. If your body doesn't know how to activate the psoas muscle very well when you lift the leg, you're going to be using other muscles. So if you've got a weaker psoas that needs some therapy and you're doing leg lifts, it doesn't mean you're strengthening your psoas. But what we're doing right now, if you follow every little step the way I'm teaching you, you're going to be strengthening your psoas. Okay, so back to the beginning. The leg rocks out to the side. We round out the back. We let the whole chest cave in and round out the lower back. You press that knee up a bit into the hand, bracing it in place. And then you pull, using your pelvis from the psoas, from this groin area where my hand is right now. That's where I'm focusing to lift myself up and over and forward. And then I'll reverse it and relax. So everybody take your hand that's the free hand, take it right here into this softest, deepest part of the groin hip region of the leg that we're working. That is the place that I want you to have your mental awareness. That's the place I want you to try to lift yourself up from when you go from the slumpy position. That's the place that I want you to think about what's happening is your femur is getting pulled up into that area. So this whole thigh bone is being pulled up very gently, very subtly into that region. So with all that in mind, let's do it again. Let the leg drop out, round out your back, press the knee into the hand. Think about pulling your femur into your pelvis as you lift yourself up right from that. I like to call it your hip pocket, that softest, deepest area of your groin that you can identify when you place your hand in that region. Let's do one more. Press up, draw yourself up from your hip pocket all the way to forward of your base of support being those bones at the base of the pelvis, and then just come back to sitting nice and tall on your base of support, and let's switch it up. All right, so let the other leg fall out, brace the knee with the hand, round out the back, turn this way for you, push the knee into the hand, from your hip pocket, from that deepest part of your groin, think about pulling your pelvis, your femur into your pelvis as you rock forward and as you rock back, or as you hinge forward, and then under control, go back into your starting position under control, go back into your slump slowly, and then relax the hand pressure, the knee pressure into the hand. So your knee's pressing up the whole time except when you come back and you have relaxed everything. So continue a couple more times at a pace that feels similar to the pace I've been demonstrating without necessarily the pauses that I have to give for further explanations. Just keep coming back with your awareness to the same area, that deepest, softest part of the groin. That's where we want to be getting that activation of muscle to draw us up to an upright position. And relax. Okay, so we just activated the psoas some. We activate it in a shortened range of motion, right? Because from the sitting position, your psoas is already very shortened. We shortened it more with what we did. Neutral hip position is just standing tall, right? But as soon as we sit down or lift the leg up, now we're in hip flexion, so the hip flexor muscle, like the psoas, is shortened. Let's work on lengthening it out now. First, we're going to do a static stretch, meaning we're not going to activate the psoas in this position, not consciously anyway, and then we'll go into transition into an active stretch. So what you're going to do is get side sitting in your chair and just get the side of you that's on the chair, just that butt cheek. So the leg that's going to go behind you, that butt cheek is off the chair. And you're going to get your core nice and engaged through the abdominal area. I want you to start exploring some stretch by sliding or taking this back leg further and further back while staying nice and tall and engaged through your core and through your upper body. Keep reaching tall. Slowly come into a position that feels like a healthy stretch for you. And now I want you to go back to that breathing that we did at the beginning, where you're trying to bring space and inflate your pelvis like it's a balloon. So got this positional stretch, and you're going to breathe right into your pelvis. You can be a little more specific and really try to breathe right into the front of the hip that's being stretched. So I like to breathe slow and steady, about 5 seconds, 4 to 5 seconds in. So maybe keep count in your head, 4 to 5 seconds out. And work with that idea, that 360-degree breath. 360, the balloon is a good representation of that. We're not just breathing into one side of the balloon, we're breathing into the entire balloon, 360 degrees. Your pelvis is the balloon, 360 degrees of breath into it. And let's come out of that slowly. So slowly shift your weight more into the chair and then slide your leg forward to come out of that. And let's turn it around. Do that same static stretch on the other side. So set yourself, before you even start taking that leg back there, engage your core, reach your head nice and tall, anchor your rib cage in, start sliding that leg back until you feel that nice stretch in the front of the hip. It might be more thigh, it might be more front of the hip / groin. And stay nice and tall. Try not to overarch your back. Just start breathing into the pelvis, 360-degree breath. It might be helpful to put one hand down there right where the area of the stretch is and target your breath. The idea of breathing right into your hand, but as fully as possible. So you can imagine hands all the way around the front, side, and back of your pelvis. So you're trying to breathe into all of those hands because, again, this is 360-degree breathing that we're trying to generate. You might be able to continue to slide that leg or pick that leg and inch it back behind you as you stay here, but just listen to your body. Don't try to max anything out right now. And relax. So as you relax, shift your weight fully into the chair. Get that, you're in this big, deep stretch position. Don't try to come out of it, but with a lot of weight on that leg. Slide it forward. Spin yourself back around. And find that same position you were in a moment ago. We're gonna add to it now. Now we're really gonna get into what I talked about, being able to control your range of motion. Flexibility without control, I don't want it, unless you're just, you know, wanting to show off to your friends what a deep stretch you can do. Because if you can't control your body well in that position, then it's not very safe. So find that positional stretch, and now what we're going to do, very gently at first, you can increase your effort based on your perception of how safe it feels to you. You're going to start pressing your foot of the back leg into the floor. Stay nice and tall. Press into the floor for about 5 seconds. You're activating these hip flexors as you do that, and then relax that pressure. And then see if you can get into a little bit deeper stretch. See if you can inch that foot and leg further behind you now. And when you're ready, you're going to breathe in for about 5 seconds. As you breathe in, you're going to press that leg into the floor. It's as if you were trying to swing your leg through the floor and forward to kick something in front of you, but you can't do it because you're pressing right into the floor. You relax after about 5 seconds. You relax the pressure. Don't relax your core. Don't relax the staying nice and tall and reaching through the head towards the ceiling. And one more time, press into the floor with the leg. This is isometric, so no movement's happening, just a tensing of the muscles in this position, training them to do their job at this end range of motion here. After 5 seconds, relax. And if you want to, you can just see about going a little deeper, or if you feel like you're at your edge of what feels like the right amount of stretch, then don't go any further. Shift your weight now into the chair, off that back leg, then start bringing it forward and spin it around. Guys, all the sitting we do, this is a great stretch, either the static or active versions for you to do in a chair as a little movement and body awareness practice without having to stop and do a full routine of anything. This is the area that's the most crunched up on you when you're sitting. Is what we're stretching right now. So we're doing this in a chair. So that's quite convenient just to transition into a stretch from the chair for this hip flexor region. So find that stretch for the back leg. Now gently press the toes into the floor. You can build the tension over the 5 seconds as you're inhaling, but you don't need to press hard. As you exhale, you relax the pressure of the leg and you explore a little bit more stretch if you feel comfortable with that. If you feel like that's kind of what I should be doing right now, don't try to go any further. Just stay there and do the repetitions of contract. 5 seconds, relax for about 5. And we're aiming to do 3. I think you'll be on about your 3rd set now, or finishing that up. 3 to 5 of these deep active stretches is for starting out is what I would recommend. If you've been doing it for a little while, you could do a set of maybe 10 activations. I'd keep it at that. When we're exploring in range, I mean, I'd say for the most part, when you're at in range and you're activating, when you're being very conscious, you're getting a lot of workout for those muscles. I would generally do about 5 reps at most before I would switch to the other side. Maybe come back and do another set. But you start to get up towards, anything past 10, now you might be asking for some strain in those muscles. Okay, so we've activated the psoas in a short range of motion. We've activated it in the long in range of motion. Let's do some work now for the posterior hip. So if you've been doing these sessions with me the last month, this one you've already had it if you've joined the lower body class. So come nice and tall, sit nice and tall on the base of on your base of support. Cross one leg over. If you're very tight in your hips, you may not be able to have your back straight here. You may already have this knee up and be rounded out. That's okay. Just don't try to come any further forward if when in just a moment when I demonstrate that. Just stay in this position, work on being as tall as you can, and work on the downward pressure of the leg. Everybody else, if you can sit tall to begin, the next thing you'll do is press this leg down towards the floor, the stretched leg. So the knee and foot, you're pressing them down. And then you're going to hinge forward. Bring your awareness back to your hip pockets. Now, both of them, right, it's like your femurs are being sucked up into your pelvis. And as that happens, your pelvis is rolling over the ball and turning down towards the floor till you feel a nice stretch, and then you're going to hold that. You still are pressing this leg down. After about 5 seconds to get out of this stretch, you're going to make that same a little extra effort through the leg to push yourself up, and we'll repeat that. Okay, so this you're getting this. You'll get a stretch back here in your butt if you don't press the leg down, but you won't be training control of that stretch, which is a big part of what we're trying to do here. We're training this joint to be stable and well oriented while we explore end ranges. So press down, pull those femurs energetically up into your hip socket to tip you forward. You're still pressing down. Challenge your range of motion here. You could probably go a little further than where you start to feel that first level of some stretch, but always listen to your body. Don't go further don't go past where your mind is wondering, is this okay? If you're questioning if it's okay, back off. Come out of it by pressing up and relax. We'll do that a couple more times. You press down, you hinge forward, sucking those femurs into your pelvis to draw you forward right there from that hip pocket. So right now we're activating your psoas as a major assistant to get us into this deep stretch. Try to angle your weight back into the leg that's being stretched. So I'll try to walk you through that this last rep before we switch. So after you press down and you start hinging forward, just gently kind of shift your weight in a way that would put more direct pressure into that back hip where you're already feeling the stretch. It's like you're driving your upper body back or directly down into that stretched area. That's going to get you more stretch on the joint capsule. A lot of times your stiffness in your hips has a lot to do with a rigid and dehydrated joint capsule. The joint capsule, come on up when you're ready. The joint capsule is like this big, thick sock. It's a ligament that wraps all the way around the joint, right? So think about this femur, this pelvis, and think about taking a bandage and wrapping it around to secure them together. That's essentially what your joint capsule is like, as opposed to just being one little strand of ligament from here to there. It wraps all the way around. So a lot of stretching for your hips doesn't get you into that joint capsule, so you can stretch the muscles around, but if that joint capsule doesn't stretch, well, you could still have a lot of stiffness in the joint because of that. Switching it up, pressing down from your nice tall position. Stay here if your back is already rounded. If not, pull your femurs up into your pelvis as you hinge forward and go into a nice stretch. Keep going. See how far you can go after this, maybe after this one. And hold for 5, come up. As far as breath right now, what I like to do is hinge forward as I'm inhaling. Hold the stretch as I do a long exhale. Like, see if I can keep folding forward with my back staying straight. I inhale as I press myself up. Don't forget to be using that leg to press yourself up so that we train that control of the joint. and strengthen those muscles that are being stretched instead of just stretching them without strengthening them at the same time. Try to drive that weight into the back hip. So as you hinge forward, gently shift your weight in such a way that that you kind of drive more right into the back of that hip socket. Now we're getting into the joint capsule. And up. Go ahead and do 1 or 2 more. Press down, hinge forward. Challenge your full range of motion here with the pressure of the leg. You might be able to go further if you weren't pressing that leg, but as I was saying before, I don't personally want that for myself. Maybe occasionally, but as a general rule, I don't want to be focusing over and over on how far can I go without being able to control myself to get into and out of it with the very muscles that are being stretched. I can control myself with props and hands and etc. But I want to control the movement with the same muscles that are having that link placed into them. All right, uncross your legs. Sit forward in your chair. Step one leg out at about 30 degrees from the front. And let yourself kind of hinge forward to the upper body as you take one hand and brace the outside of the knee. So just let the knee, the whole leg kind of fold inward till it comes to a stop. Brace it there. Push against it like you're trying to come out of it, but stay in that brace position about 5 seconds. As you relax, go ahead and hinge a little further forward and let the knee roll in a little bit more. If that feels appropriate, press out. Make an effort to press out. Relax. Let it rock back in. And again, press out. So each time you relax, you're going to see if you can get a little bit more internal rotation of the hip by letting the knee and the whole leg drop further towards the floor. If you're feeling some work on the outer hip here, that's okay. If your inner thigh, if you're growing on the inside of the thigh, if you're feeling a sharpness there, back off. You're probably compressing the medial or inner side of that joint. Back off of the position and work this from not quite as internally rotated position. Go ahead and do one more. But if you're feeling this is something on the outside of the hip, that's what we're getting, where we're getting a lot of stretch. It might even feel sharp on the outside of the hip. That's probably okay. It's probably just a lot of tightness in the muscles right around there. Sometimes sharp pains are joint compression. Sometimes they're muscles. And they're nerves, but you typically know that's different. It's more like a jolt if it's a sharp pain coming from the nerve. All right, let's switch to the other leg. So from your nice tall position, you can hinge forward a bit with the upper body as you let the knee drop in, bracing it. 5 seconds, I'm going to breathe in and press. 5 seconds, I'm going to relax the pressure and let the leg roll in further till it comes to a stop. And I'm going to press out, breathe in. And as I relax, I breathe out. I see if I can go a little further. If you feel any pain on the inner side of the knee here, just like if it's on the inside of the groin or the inside of the knee, back off. Don't work the range quite so much. Just keep going at that pace that you're on right now. About 5 seconds pressing, 5 seconds relaxing. With each relax, you can hinge a little bit more at the hips, meaning fold forward from the waist, keep the back straight. And go ahead and finish that one up. Do a quick time check here. Okay, wow, all right. So let's finish up with activation for the inner thighs. So what we're going to do is, from your sitting in your chair, take a nice wide stance here with your legs, all right? Wide enough that you might, if you're tight enough, you can just sit here and have wide legs and feel, oh, that's a lot of stretch. But you may not feel that stretch yet, just with the wide leg position. But get wide, then take the hands to the inside, keep the back straight. Demonstrate from the side here. I'm just going to hinge forward. As you hinge forward, again, suck those femurs up into your pelvis. Let that psoas activate to draw you into deeper hip flexion. So as I do that, I'm going to slide the hands down the inside of the legs till I've got a nice stretch in the inner thighs. Then I'm going to hold and I'm going to press my legs, my knees against my hands or arms, bracing them in that position. 5 seconds. As you relax, see if you can fold a little bit more forward, keeping your back straight. See if you can press your legs a little wider, knees a little further apart with it, using your arms to assist with that. Come to that next level of stretch, or position of stretch. Press for about 5. Relax after that. See if you can deepen by pressing the knees further apart and or folding further at the waist. 5 seconds on, 5 seconds off. Inhaling on, meaning inhale when you press. Exhale when you relax. Body's typically going to let more length into their tissues when you're exhaling. And maybe one more rep with that. And when you're done, come on up. So we didn't get through a second set with these rotational stretches for the hips, but we got that extra emphasis today on the psoas in the shortened position and the lengthened position, assisting us to go into these types of stretches, the hinging forward from various positions. So with that, let's stand up now and let's do our squat again to reassess. If there's one other thing I would do, go back and do slightly differently than this class, I would have just reminded you throughout it to do more breathing into the pelvis. I got kind of chatty and talkative and on this and that during the session. But I've recorded this one, so I'm probably going to make this a replay for you guys to watch. If you do it in the future and you kind of get the pattern down, then you could do more rep, another set of anything you want to. And I would say do more breathing into your pelvis throughout that. All right, so from your nice tall position, hands forward, squat down, do 3 to 5. See how far you can go now with your back staying straight. See how it feels as far as just sense of fluidity and ease. If we've done more stretching in the chair with those leg cross positions, you might have a little bit more. Like I said, we didn't get into a second round with that today. But again, if you do this at home, you can fast forward or skip through some of the times where I was chatting so much and give you rationale for everything and do another set of some of those exercises. So guys, we're going to wrap it up there today, except for questions, comments, feedback. So I'll unmute you all. And any questions or feedback, David?
No, just thank you.
Oh, yes, you're welcome.
Yes.
Thank you. Yep. Gotta go.
All right, guys. All right. Thank you. Take care.
Thank you.
First time I ever felt my psoas, Zach.
First time you felt it?
Thank you.
All right. Never too late. You're welcome.
I just got introduced to my Psoas.
You what?
I just got introduced to my Psoas.
Got introduced to it. Well, you and Patrick, you guys are neighbors, so you can hang
Yeah.
out in your porches and wave at each other and do your psoas work.
We
We're
got
having,
all
we're
night.
having Zoom happy hour tonight.
All
Yes.
right. Well, have fun.
All right.
All right. Take care, guys.
Bye-bye.
Zach, I was just